everybody, my name's Sarah Dewar. I'm the Director of People at Connect Health, which is a healthcare organisation employing around 700 people across the UK with a head office based in Newcastle. I'm going to spend a couple of minutes talking to you about how we've been engaging with our workforce from a communication and a wellbeing perspective during the coronavirus pandemic. Since March, we've been wholly working as a home-based organisation on a temporary basis. We have probably near on 90% of our colleagues working from home, including clinicians delivering their consultations from home and using technology, and also a full contact centre which we mobilised to home working within kind of a few days. So very similar in terms of lots of people's situations, with a vast number of people working at home unexpectedly. Communication and wellbeing have been really important for us, and I wanted to talk through some of the practical things that we've been doing at Connect to engage with our workforce. So from a communication perspective, the main priority for us was regular communication from the top to be really clear on our messaging. From the start, we initiated daily executive update emails, and a few weeks into the pandemic and the home working, we implemented Workplace by Facebook. We thought it was really important to have an internal social media platform that people could engage with on a professional level, but also have a bit of fun through as well, with lots of different initiatives. We've used it for plenty of initiatives, activities, wellbeing activities, Q&A sessions. So that's been a really important one for us. Also, with regards to our communication, we've talked a lot about our return to the workplace plans and our exit strategy. Our approach has been to involve colleagues every step of the way with that, and to talk openly and honestly about our intentions to alleviate anxiety as well. We've also kept our emphasis on recognition really strong throughout this as well, so continued with our quarterly recognition winners. We have had Thank You Thursdays. We've done all sorts of things to keep people motivated and recognised. From a wellbeing perspective, we set up a resource library on Teams for our managers for managing through a pandemic, managing remotely, lots of different topics. And also we've signed the Time to Change pledge to demonstrate our commitment to mental health in the workplace, which we visibly signed during the home working to show, the importance of supporting people with their mental health. We've run a number of initiatives which Workplace has really helped with. So we had Active April, earlier on in the lockdown, where we encouraged people to talk about and share photos and videos of exercise. We moved on to May menus in May, where we've had a real focus on sharing healthy eating recipes and talking about the importance of health and nutrition. And we've continued with an exercise and wellbeing focus in June and July. And also taken our leaders through a Leading Through Anxiety programme, our senior management team, so they feel equipped with dealing with these difficult conversations on anxiety. We've also recognised that Teams and Zoom fatigue has become really real for us, and we decided that wasn't going to work for people. It was causing anxiety, it was causing exhaustion. So we now have meeting-free Fridays. We have 45-minute meetings as opposed to an hour. We have a no camera unless you want your camera on rule, and all sorts of other things to make sure that people feel they don't always need to be switched on. And really getting a culture of it's okay to not be okay. I think that has been incredibly important for us. We undertook a colleague survey probably about 6 weeks ago, and over 95% of colleagues working for Connect told us they felt supported by their line manager and told us they felt supported by the business. And actually the vast majority of people who filled in that survey had at least one positive thing to say about their new working arrangements. Anxieties did come out, that feeling of balancing home life, work life, childcare, other caring responsibilities, isolation, and we've worked really hard to encourage that open and honest conversation. We understood from our survey as well that our workforce were feeling anxious about the return to work, hence why we've had the communications being really open and honest. In terms of what's next for us, we're starting to move back to face-to-face clinical work in a slow and steady manner, and thinking about how we can open our head office again in a phased and really gradual manner that's as safe as possible for people. We know through colleague surveying our workforce want flexibility, and we're working hard to shape up what that could look like. So a few tips from me, a few bits of information, like I say, communication and wellbeing being at the heart of everything we do. Thank you.